Well, the only thing that I knew right from childhood was that I would be a doctor. There was not much of a choice really, and if you were a good student, the only two choices that were there at the time that I was growing up was become an engineer or a doctor. And for me, there was no love lost with maths, so engineering was certainly out, and that's how I chose medicine. And I always could see from around me that, serving other people and going out of your way to do things evoked the maximum amount of happiness. So that's what prompted me to become a doctor. The only thing that I knew at that time was I wanted to do a clinical subject in which there is going to be a lot of people interaction. There was nobody to guide me because I was the first doctor in my family. And then my rank was close to that rank where I would get surgery but not medicine. So I chose surgery at that point of time, and then like I say, the rest of it is history. So when I finished my training in Maulana Azad Medical College and Lok Nayak hospitals, I was looking for a job, and I landed a registrar's position in Apollo Hospital in Surgical Oncology department. And that is where I found my mentor, who has been my guide throughout my career. And he had this foresight to tell me, look, you have to choose a particular area because surgical oncology is huge. And my simple mind told me that, you are a woman and it is possibly better to make it woman-centric, so probably breast cancer it would be. And that is how I landed up going to the UK, to the Royal Marsden Hospital in London to do a fellowship in the breast unit there. And when I came back to India, I did several years of training in a very heavy oncology unit, and since then I have just focused only on breast cancer, and that is what I love to do. When I joined Maulana Azad as a postgraduate in general surgery, the day after I joined I was diagnosed with typhoid, and I took off work for almost 10 days. I was not there, and in fact, interestingly, I was the only woman in the entire surgical department. So when I went off, my male colleagues were quick to say, this girl has developed heebie-jeebies and has just left surgery. So that is the way that women were looked upon. And today, fortunately, things have changed because you have more women taking up general surgery. But in those days, there was still this thing about, why is a woman trying to find her feet in a male-dominated bastion. So it was tough in some ways, but I really enjoyed my journey. And what I realized, the easiest way to deal with this situation was to try and do all those things that they did, probably just slightly that much better. So the effort was, of course, much more than what they put in, but then, it has never daunted me in any way. I'm Dr. Geeta Kadayaprath. I'm a breast surgical oncologist and an oncoplastic breast surgeon. And this is my story.